Hello, and welcome back to my YouTube channel. We're now on episode 4 of me as a birth doula and childbirth educator and medical assistant working in labor and delivery and postpartum with breastfeeding and complications after birth. How I am kind of just preparing for my first pregnancy and birth. Just happy you all are here and joining me again. I am 27 weeks in 2 days. It feels really bizarre. The time has been flying so much. But yeah, I'm very grateful you're here. If you're still with me, listening and getting prepared for your little ones. I've been wanting to do vlogging and following my own pregnancy just as my own personal journal and also just for education for other parents out there that are getting ready to welcome a little baby. So yeah, 27 weeks very soon. I'm feeling really good still. I have a little bit of like facial things going on. I'm very dry. I don't know if it's the Sweden weather, honestly, because it's really only when I'm here that I get really super dry. And I think my Puerto Rican genes just miss humidity. But yeah, it's kind of my only symptom so far in terms of skin related issues in this pregnancy. I've been feeling, sleep has been hard. Harder, I would say. As you may remember, I maybe mentioned it in my last vlog, but my arms and hands are falling asleep a lot at night, and it's gotten worse over the past 5 weeks. I'm on vacation right now, so I have been with the occupational therapist and got the diagnosis that I do in fact have carpal tunnel syndrome. She gave me these 2 braces that I am now wearing at night on both of my hands, which also just keep me awake because they're not the most comfortable, of course, and it just feels really, I don't know, awkward, I guess. So that's been my weird pregnancy thing. As a doula, I would always tell my clients, you know, that would have something going on. Like almost everyone that I've helped and supported through birth and pregnancy have had something weird going on. And this is just my weird thing. And I'm still just so grateful that I get to experience this, that I'm here, that I'm feeling good, that this is so far the only thing that's kind of shown up in my pregnancy so far. I'm just really hoping that it goes away after pregnancy, because I've had several colleagues now tell me that they also had it and it's fairly common, and they even had surgery done. And it's a very simple surgery apparently, but for some people it doesn't go away after the birth. So I'm really, worried that it won't, but I'm rooting for it to go away. Because I can just imagine, since I do have big goals that I do want to breastfeed, just the hand positioning, because there's all these like tests that they'll have you do, like push your hands together, do like this, like different types of things, and my fingers just go numb. They just like completely go numb when I'm biking, since, you know, in Sweden people bike a lot. So that's all that I do. So they fall asleep while I'm biking, while I'm cooking or like mixing anything, like doing anything with my wrists. My arms are just going numb. And then of course all night. I don't want to sleep on my back because of it just is a bit harder to breathe, and it doesn't promote proper like positional for baby. So I have been really struggling at night and during the day as well. So I was at the doctor as well after the occupational therapist, because she said it could take about 4 weeks for these nerves, because nerves are strange and we don't know how long it'll take, but 2 to 4 weeks before I'll see like a difference. And I started feeling a little stressed because I was supposed to go back to work on June 23rd and it's June 16th today. So on Thursday I was at the doctor and she granted me sick leave. So in Sweden you can get 100% sick leave of like that you don't need to go back to work because of a pregnancy related, you know, just just different types of pelvic pain, carpal tunnel. There's lots of different reasons why people would go on sick leave during pregnancy, but mine was very valid. She even did some like different movements like with my pelvis, and I kind of was like ow during some of those. So I think that there's maybe, of course, there's a lot of hormones and a lot of shifts happening in the body right now, but relaxin is one of the ones that just makes all of our connective tissues, just like everything, just a little bit more loose and flexible. So I guess that's what's happening down there in the pelvic area, that things are just stretching and all of that. So that's maybe what I'm feeling. Otherwise, baby boy, he is moving a lot. He's moving so much more than I had expected him to do it this week, 27 weeks. I'll wake up at like super early in the morning of him moving around in there, and just all throughout the day. As long if I'm not moving and I sit down and just chill for a little bit, he's just on the move. So it's so amazing. It's like such an insane feeling, and I've just longed for this for so long that I'm just like, oh my gosh, there's a human inside of me. It's incredible. Like I'm mind blown every day that this is a thing that we get to do as, you know, a species on this earth, that we get to bring life into the world. It's just, oh my gosh, it's so cool. Otherwise, the past 5 weeks, it was really nice to stop working. Right now, I've been just really enjoying vacation and just being off. My husband had vacation as well, so we did like a mini vacation up to this small city called Halmstad that we're moving to. My husband got into his master's up there, so it's an hour and a half away from where we live right now, and it is a very small coastal city, but we've never been there. So we're like, let's just go up there for this weekend and see what it's all about. And the weather was beautiful, and there's this really famous beach that's called Tilla Sand, and I had never been there. I lived in Sweden for 13 years and I had never visited this beach, and it was the most gorgeous beach. Like the sand, I can't even tell you, it was like gold. It was so beautiful, and the weather was just amazing. I am not a person that goes into the sea in Sweden. I don't go into water at all, really, unless it's like in Turkey when it's beautiful and it's amazing and it feels so good. But cold water has never been my thing. Cold plunges, that was never a thing that I would ever do. But my husband is amazing at just really just encouraging me to do really challenging things, because that's when the reward is the greatest, is when you really don't want to do something. The reward is so much greater. So he totally convinced me, and I got into the sea twice. Like both days I was in the sea, and I just kind of like dipped up to here. I wasn't like full on swimming or anything, but my husband was swimming. He was all the way to the point where I couldn't even see him anymore, because he's just a sea boy, a water boy. He grew up in Turkey, and that's just his jam. But I was like, this water's 14 degrees Celsius. This is freezing. How am I even gonna? Oh, and then I got worried about the baby. I was like, oh my gosh, he's gonna get so shocked. But yeah, he was totally chill with it, I guess. But it was really, really cool. It was really nice, very refreshing and rejuvenating, and a really great time to get away from just everything that we know so far in Malmö. It's like I've really only lived down here in southern Sweden since I moved to Sweden, so I just feel kind of done, and very excited for this new chapter in a city where we know nobody, and it's going to be really exciting, closer to the beach, closer to nature. So really been enjoying our time away. Otherwise, I also had that lump on the back of my neck. So I went and got what's it called? An MRI, but it was like without contrast, and it was totally safe. I was really freaking out for a little bit. I'm like, is this really safe? Is this okay? While doing this while I'm pregnant, and it was totally safe, they said, but it was up to me. But I did it, and it came back because it's like a 5 centimeter like lump on my back. It's like on my upper back, and so They did the imaging. It came back as like a just non-harmful lipoma. So very common, just like a gathering of fat. So that's what's going on. It's another weird thing. But it really did start before pregnancy, I believe. So not maybe a pregnancy related thing, but definitely something I discovered during pregnancy. But huge relief that that's just like not, it's a type of tumor, but it's not dangerous. So I'm gonna keep an eye on it. Otherwise, that's the only other thing that has been coming up. So what am I doing to prep right now? We're still doing, I do about 2 to 3 times a week strength training. My husband has a new program for me, so I just started that one last week. And it's been really good, feeling really good. I'm kind of freaking out about my glucose test that's coming up. It's on June 24th, I have that. And so I'm feeling a bit like, a little nervous because this is a test, like this is something I could fail. Like, I don't know why I'm nervous. I have no symptoms that would make me a high risk for gestational diabetes, but I am very much like, I've had lots of clients that have had this. And so I know that, it's a whole thing. So it's the one last thing that I have is going to do my glucose test here. And just in preparation for that, I've been really walking and really making sure to do my 8,000 steps a day and definitely 15-20 minute walk after eating, because just to help my blood sugars and just to keep things good. But it's felt really good. May and June are very unpredictable months in terms of weather in Sweden. So it has been some really beautiful days, some just awful days, but I've really gotten out. My husband has come with me. We've been walking and manifesting about our future and the baby and the birth and just like all of the things we want to do as a family. And it's just so, it's been really, really good. But yeah, that's something that I'm kind of nervous about, and kind of preparing to, beat these, beat the test. And so I'll keep you posted on my next vlog how that all went. Otherwise, still doing our spinning baby stretches. So the side lying release stretch from spinning babies is something that we're still doing, if not every day, but every other day, just to keep things really good, feeling good in the pelvis, releasing any tension, and still eating good amounts. I'm eating a good amount. I feel like I've gained a lot of weight, so more than I had anticipated. So again, why I'm still like really committed to staying on a good routine with my walking and working out, because I know how much harder it is to lose weight once you've gained the weight. And a lot of people may not like to talk about weight or shy away from talking about weight. But I made this channel because I really want to be super transparent in what's going on in my mind and my body. And for me personally, I think it's the more weight you gain, the more high risk you become. And that's not just a personal opinion. That's how the medical system sees it. They do everything by your BMI, and think what you want about BMI. I know there's not a ton of evidence to support this, but it's still how they measure things during pregnancy. And if you are on a higher end of that, there are more complications and risks, and for baby too. So I'm just really trying to do what I can control, and I can control getting out and moving my body every day. So that's what I'm really, really trying to stick with. Otherwise, right now I started this book. It's called Birthing from Within. I was working, when I was in Portland, Oregon, I was working with this amazing doula. Her name was Christine Disposito, and she took over this Birthing from Within method. And I had never really read her book, but I had always had it, and I've got so many books. Like, as a birth doula, like, we love birth. We want to know everything about birth. Most of us, I'm not going to speak for every doula on earth, but most birth doulas love education, love evidence, love exercises to get couples ready for birth and prepare for birth. So as a childbirth educator too, I would have different exercises in my classes of like, here are some things you can do, here are some positions, here are some this, but this book is something completely different and something really engaging for both partners. So that's been really good. So I've started to see, now I'm out of breath. But yeah, I would really recommend it for those who are doing a childbirth education class or not doing one. I still highly recommend reading this book, no matter where you are in the world. Other ones that I have read that I also do recommend, especially if you're, I mean, you don't have to be a first-time birthing person, but one that is so good is Ina May. Anything Ina May is just like worth reading if you really love birth and want to know more about birth. But Ina May's Guide to Childbirth, it has a lot of birth stories in it. And birth stories are one of the things I would tell clients always, to listen to positive birth stories. Like, we don't need, like, people love telling you their scary stories of like, this person, this happened to that person. And we know all the scary stories. We know that there's a lot of those out there, but there's way more positive ones than negative ones. And I really want to bring those to light. And so that's where I've really learned a lot as a birth doula and childbirth educator, is really listening to stories, reading stories, listening to podcasts about birth stories. So would highly recommend Ina May's Guide to Childbirth. I really want to read her book, Spiritual Midwifery, and I really want to become a midwife. I think that, you know, all doulas have this, maybe not urge, but like just a fascination with birth. But I feel like I'm at the point of my life where I'm ready to take on more responsibility and start that journey toward being a midwife. So that one's on my list for later. But any of those out there, excuse me, maybe who are studying to be a nurse or have plans to be a midwife, like Ina May's Spiritual Midwifery book is one that a lot of the midwives I've looked up to and respect have highly recommended that. Another one that I would highly recommend that I've also read is the Fourth Trimester book. And this is all about postpartum, breastfeeding, taking care of yourself, your mental health, your relationship, all of these things. So it's really about, a postpartum guide to healing your body, balancing your emotions, and restoring your vitality. So it's a beautiful book. I think there's a lot of really good information in that book for just preparing for postpartum, because everyone's like, oh, birth, I gotta just prepare for the birth and then everything else will just work itself out. And it's really not the case. Having worked in the postpartum unit at the hospital, having worked with doula clients postpartum, it's weeks, months, years of healing after such a huge event in your life. And you want to be as prepared as you possibly can be with all the information that's out there. And so I would really recommend taking time to reading about the fourth trimester, which is those first 3 months specifically, but also just like in general, the first years of being a parent are crucial, really, really crucial to start reading more about. And also if you plan to breastfeed, there are so many books about it, but read a book. If you have a class near you, a breastfeeding class, I think that you should definitely consider taking it, or just really planning to invest in a lactation consultant, like an international board certified lactation consultant, an IBCLC. There are not a lot of them here in Sweden, actually. There's a couple here and there, but it's definitely not the norm. Postpartum units in hospitals do not have a lot of people, like nurses and medical assistants, that are trained in breastfeeding. And I work in the hospital, so from experience, there's not a lot of people that are super passionate about helping you with breastfeeding and helping you, you know, with different soothing techniques for baby, different ideas for how to nap with baby or sleep safely with your baby. There's so many ways to do this right, and there's a lot of opinions out there. But the people working in the hospital, I mean, it really depends on who you're gonna get. So really advocate for yourself in that sense of just lining up really good postpartum support and breastfeeding support, especially if you're planning to breastfeed. And then in those early hours after birth and days, if you, depending on how long you plan to stay at the hospital, if a hospital birth is in your plan, really try and get someone on staff that loves breastfeeding, loves teaching breastfeeding, and really wants you to succeed before you go home and make you feel empowered before you go home. Because I've gotten lots of people come up to me because I would sometimes work for 3-4 days in a row and have the same patient maybe all those days, and my goal was always like, I need to make sure that they are feeling confident enough about breastfeeding to go home. And yeah, I think it just depends on who you get. So make sure and have someone that can really explain things to you. And if you don't, and if you're not satisfied with what you're getting, ask for someone else, because you deserve it. You deserve the best care ever in your life during your birth and your postpartum experience. And energy and the people you surround yourself with in this time can make all the difference. So really, really know that you deserve the best. And it's how we're going to change the medical system, is we have to have more people that are passionate about this field working in this field. It shouldn't just be considered a job. It should really be considered your life's work and something that you're always learning and getting better at, and getting sent to trainings and getting information from, just colleagues, and learning together, and having weekly, daily educational opportunities for, just development. Anyway, that was a big rant from a birth doula that really just loves empowering people. And yeah, I was thinking I'll end this little vlog with a little belly photo. This is my little boy now at 27 almost weeks. So incredible that we get to do this. I will update you all again soon, and again start interviewing people as well, so it's not just me and my face that you need to listen to. So yeah, I hope that you'll continue to follow along, and I hope you're doing amazing. And reach out if you have any questions ever. I love this stuff. Take care. Bye.